Over the last several years, we've asked our members what you'd like to see from us. And we've got a lot of great feedback, a lot of great ideas. And one of the consistent themes has been do more to engage patients in using cost and quality information. This has come at a time when the Alliance has had nearly 10 years of experience in providing this type of information. The one thing is clear through this feedback is that it's not enough. We need to do more in terms of how we put this information in the hands of employers and consumers. So today, after approximately 16 months of research and development activities, which has included forming employer and consumer advisory panels, the Alliance is preparing to introduce its new Find a Doctor tool. This tool will share available cost and quality data with consumers as they search for doctors and hospitals in our provider directory. And again, it's placing this information into the hands of consumers and patients at the time of need. We are still putting the final touches on this version 1.0 tool, which you'll hear a whole lot more about here in a second. But early tests from the consumers that we've shared this with and have tested this has been very positive. And often what we hear is, wow, this is really cool. So hopefully you guys will, as the consumers who were part of this panel commented as well. When we began this project, we knew we wanted to push the needle in this area. We did our research. We went out for vendor RFP just last July, 12 months ago. And we hosted in-depth interviews with some of the leading vendors in this space. Last October, we chose the vendor partner of choice. And in the end, there was no question that the Doctor.com team was the partner to make this now shared vision a reality. We specifically chose this vendor in Doctor.com for their energy and enthusiasm for this project, their desire to, quote, knock it out of the park, and their deep understanding of consumer web behavior. I couldn't be more pleased at this time to introduce two leaders from the Doctor.com team and the Core Alliance, and one member from the Core Alliance project team to tell us about the research and ideas behind Find a Doctor and what you can expect from this exciting new tool. First speaker will be Andre Zamilis. Andre helped launch Doctor.com in 2009. Andre continues to oversee daily operations at Doctor.com in his role as the company's president, which includes leading the product development and technology teams. Reed Mullins. Reed is the co-founder and vice president of business development at Doctor.com. His responsibilities include managing the sales organization and adding strategic partners to the Doctor.com network. There's a full bio in your folders, so you could read more about Andre and Reed. Our third speaker is Ryan Peterson, member of the Alliance team. Ryan is a programmer and analyst with the Alliance. Before joining the Alliance, Ryan worked for Epic as a technical analyst and technical coordinator. Prior to that, was a lead analyst and member of the senior professional staff at the Johns Hopkins University Applied Physics Lab, where his responsibilities included leading the evaluation of communications, radar, and command and control interfaces in ballistic missile defense tests. I do believe that Ryan may be the only Alliance employee to have held top secret government clearance, unless we just don't know, which could happen too. But for the next at least 30 minutes, enjoy a preview of the exciting new development in our partnership with Doctor.com and the Alliance in the product Find a Doctor.
Great, thanks so much, Kevin. I'm Andre Zamilis, co-founder of Doctor.com, and unfortunately, unlike Ryan, I am not a rocket scientist, but I will try to still keep this interesting. First, it's just been really fascinating to be here and just to listen to some of the dialogue, and Dr. Fendrick's presentation was also very fascinating to us. We sort of come from the DNA of a consumer-focused internet company where we, since 2008, have been all about building doctor search experiences for consumers. They're all about engaging consumers and being very focused on the consumer's needs. And so it's particularly interesting to us to have the opportunity to work with such a great partner in the Alliance to go much deeper and sort of do some of the things you'd always wanted to do but just didn't have the ability to do in terms of servicing real sort of high value data around procedure costs and quality and a lot of the things that have been discussed. In the software world, we talk a lot about sort of finding hacks, and not hacking in sort of the nefarious sense, but hacks as in shortcuts within a system that get big results and make a big impact. And I think some of the things that we'll hopefully be showing you today would sort of qualify as that, as ways of really getting people more engaged and leveraging sort of tools that consumers had never really had before to make a big difference in how they can find care and benefit from being connected with the best doctors at the best time. So I'm going to give you a little bit of background just about our company, Doctor.com, just to set the stage, and then most of my talk today is really going to be about just sort of consumer behavior in general, how consumers interact with online tools and consume information, and how we brought some of this to bear for this particular project. So we got started in 2008. We originally set out to sort of create a universal doctor finder at Doctor.com, which still exists today. And in building that and doing a lot of research and development work, spending a lot of money, aggregating lots of data, and building a lot of technology, we pretty quickly realized that there was a much larger opportunity for us than to just be another doctor finder website, and that we could open up some of the tools and technologies and data that we'd been assembling and had successfully introduced to the market, and find other organizations to work with that already had big member bases who could benefit from this. So we got started working with some of the largest consumer health destinations. We power Doctor Search for Yahoo Health, for example, for Healthline, for Quality Health. These are sites that, in aggregate, along with some of our other partners, reach about 20 million people a month who are looking for health care. So it's big numbers, a lot of great data we get from that. And we've also been fortunate enough to have about 10,000 physicians actually engage directly with our platform and use it to connect and interact with patients. We get great data from them. So we're always looking at this data, improving, analyzing, and really we filter that back to build more sophisticated doctor search, find a doctor capabilities for people. And as you can see from the image here, the way people find doctors has really changed a lot in the past 10 years. And actually, I'm curious to see a show of hands here, who the last time they went to find a doctor or look up information about a doctor or a symptom used either their phone or their computer at some point in time to find that information. Wow, okay, so that's actually higher than normal, which is great, speaks well for folks in this room. The reality is about 100 million people right now in the US go online to find care. So their primary way of searching for care. It's about a third of the population, so it's a big number. And 52% of, or sorry, I say about 50% of those who search end up actually making an appointment as a direct result of that search. So people aren't just sort of going online to shop around and compare information. They're doing that and they're actually calling a doctor or using an online scheduling tool and getting in the door. And when they surveyed a group of consumers recently, more than half said that they actually really wanted tools that gave them both quantitative and qualitative data around doctors and hospitals. So in addition to sort of cost and quality metrics, also some softer details like peer reviews, user reviews about doctors, and rankings and ratings and satisfaction information. So people are really hungry for more than what they're getting today, which is often a sort of one-size-fits-all, alphabetized find a doctor experience. And I'm really proud that we've been able to bring some of those tools into action with the Alliance, which you're going to see in a bit. You can see also some other interesting stats here. 1 in 4 people will read an online review of a doctor before they see that doctor. And sort of what's happened in healthcare is not unlike what happened with travel, with the way people used to be called a travel agent, right? Or you'd open a magazine to find where you're going to go next. I don't know. I haven't used a travel agent, I think, ever. I think probably my travel agent is TripAdvisor and Hotels.com and Expedia and Orbitz, and that's just the dynamic. It's completely changed how people find and interact with vendors in that industry. Same thing is starting to happen with restaurants, right? People book on OpenTable and use menu pages to look at the menu before they go, and there's all these consumer sites that sort of have totally disrupted that space. That's now really happened in healthcare. And so what this means is, as people all have some skin in this game, we can't just go and put a traditional doctor directory, that sort of big phone book that people used to get that was in alphabetical order. You can just throw that online, right? That really isn't a worthy consumer experience. And it's funny, we have another client who is nowhere near the level of sort of sophistication and forward thinking that the Alliance is. And they were arguing to us they didn't really need to redo their doctor search because it was just fine as is. And I said, well, I couldn't even find it. And they said, oh, no, there's a link on our site. And you go, and it's a 1,000-page PDF document that can't be searched of doctors listed in alphabetical order. And I said, this is probably really good if you're a doctor whose last name starts with A. You're loving this feature. Everybody else, and God forbid your last name starts with Z like mine, it's probably not so good for you. So, let's talk about what makes a great doctor search experience. Really, I think folks like Google and Apple have raised the bar for everybody else, right? Anyone who's used an iPhone or who went from AOL Mail to Gmail sort of knows what a really great consumer experience is versus an adequate consumer experience. So people today really expect, at a minimum, that a tool for them is going to be fast, it's going to be intuitive, and it's going to be informative. And to break down these things really quickly, fast means takes less than 20 seconds to load. I don't know about you, but I won't wait for a website that takes a full minute to load. That's an eternity in the broadband age. So things have to be fast. They have to be intuitive. If I feel like I need a manual or I have to go to the help section to figure out what to do when I get somewhere, you've already lost me. And even if it's fast and it makes sense, if when I actually get the information I was looking for, if that information isn't valuable, if I'm looking for a doctor and I just get a name and an address, well, that's not really going to overwhelm me so much. And the best experiences, getting back to sort of think of the iPhones of the world, right, are also anticipatory. They're one step ahead of the user. As the person's going through and navigating or searching, we're sort of waiting around the corner, knowing what they're going to want to do next, what information they're going to have within context. And they're fun to use. And there's a stat earlier I neglected to mention, but it's a critically important stat, and we're going to touch on it now and throughout the presentation. The best online experiences now are great on any device. Because, again, we have this 20 million patient strong network. We get a lot of data from that, and we look at the tools people are actually using to consume content. A few years ago, 10% of people were using their phone to browse for doctors. Now it's 25%. It's going to be easily in the high 30s by the end of next year. And what's really interesting, too, is when you break that down and look at different patient populations, it's often the neediest of patients, those in the higher risk areas with chronic diseases or from lower income areas, who are really using their phones more than anybody else. Some of them don't have computers at home, but everybody has a cell phone. Almost everybody has an iPhone now. We're in New York, you see people on the subway don't have a pair of pants, but they have an iPhone. So, it's, you can count on that being somewhat ubiquitous. So I want to talk about how we've actually taken some of these things and put them into action in the new Find a Doctor tool, and you're going to get to see more from Ryan and Reed about that in a bit. This is sort of a short list of things that we really came down and thinking that would be most important. I'm not going to walk through all of them. You can read the list, but again, a few highlights. Responsive design, which is the industry term for having one experience that dynamically changes itself based on the device type of the user. So when you go to the new Find a Doctor tool on your phone, you're actually going to see a different page than if you went on your computer, on your laptop. But it's going to have all the same capability, all the same functionality. It's just going to be optimized for a small screen, not a big screen. Location awareness. Now with all these modern devices, you can actually detect where somebody is when they're using a tool. So why not automatically assume they're searching within 20 miles of where they are? Chances are that's probably a safe assumption. And then just some other things, good form design. This is like a pet peeve for me. We've all probably used an online experience where it was very frustrating because you actually started giving your time to the service and filling out a form and putting in information, and then you went to press submit, but it was actually a reset button and you lost everything. Or you were confused, or there was too many different things to select. So simplifying information, simplifying complex concepts, and packaging it up in a really friendly user experience is important. And then just some of these other things, simplifying complex information, showing a map next to an address, having photos and videos and social content be supplemental and prominent alongside search. So this is actually a preview of the new Find a Doctor homepage, which you're going to get to see a full demo of in a little bit. And this shows, on the right side here, how it looks on a phone, and on the left side there, how it would look on a desktop. And a couple things to call out here. When I talk about intuitive sort of navigation, one of the things we thought about is, when someone lands in this page, there's probably one of two reasons they're here, right? Either they don't know necessarily who they want to see, but they know they need a colonoscopy or need a knee surgery or need a dermatologist or need to find a hospital. Or they know that they're expecting a child, and you want to give those people a really clear path to follow down any one of those sort of search vectors. Or they know they're going to see Dr. John Smith next Thursday, and they just want to get some information about him. So right there on the home page, you can see we've simplified and broken up into, you can either search for something or you can look up something you already know. So moving on, this is the search results page. Particularly, this is probably my favorite aspect of this new tool that we've built, because we talk about some of these things around steerage and around doing things like if someone be going for medical imaging and could pay 1/3 the price at an outpatient facility at a hospital. Well, this is our opportunity to sort of hack the healthcare system and actually implant in the consumer's mind that, hey, maybe it makes sense to make this decision just on their own. So when someone gets search results, they're going to be able to filter those results not just by say alphabetical order, but by how far away is this, and what's an estimate of what it's going to cost me. And if someone's logged in as a member, they're actually going to be able to see a dollar figure of a cost estimate of the bundled cost of that procedure. And based on that, we're able to surface the highest value options for them first in search, which I'll talk about the importance of that here. So Cornell University did a really interesting study of click distribution across Google searches. And it's pretty remarkable. 56%, I believe, I can't see the numbers, but 56% of people clicked the #1 result. The #2 result got about 13% and down from there. And you get to number 7 or 8, it might as well be 0, right? So there's an incredible power we have as the creators of this tool to surface the results that are really better for everybody. Better for the patient because they save money and get good care, and better for providers who are being rewarded for providing good cost-effective care, and better for the system as a whole. I'm going to actually skip over this next one because I think Reed's going to talk quite a bit about it, and just wrap up again on this concept of how everybody wins from this. So I think if you give the healthcare consumer tools to really get engaged, tools that are delightful to use, that are as fun to use as an iPhone when it comes to actually searching and going through this process of finding a doctor, and couple that with the kind of really incredible information that the Alliance is surfacing and making available, they really can't get anywhere else. There's nowhere else. I've never, as someone with that pretty high-end Aetna plan, ever had the ability to, look at what a procedure is going to cost me before I go in, or look at, real quality outcomes-based metrics for care of different providers. So coupling that with this great search experience, we're hoping is really going to get patients engaged, save them time and money, reward the providers who are providing this better service, and again, reward the system as a whole by improving outcomes, lowering costs. So I think Ryan's going to come up next, go into some more detail, but I just wanted to thank everybody. Really, really happy to have the chance to work on this project, and I think it's going to be a pretty powerful thing for your employees and members.
Before we get into some of the cool stuff of the demo, I wanted to provide a little bit of context of where we've been. What you see here is a snapshot of our current provider directory. If you went out onto our directory today and looked for providers, this is the provider directory that you would see. And frankly, it's the provider directory that has looked like this for some time. It's been a while. This is the thing that we sought to modernize, the thing that we wanted to make more intuitive, more modern, more mobile for our users. It also is where our consumers, our members, are most engaged. And so we had an opportunity here to look at some of the other products and things that we've put out and saw if there was an opportunity to integrate any of that information where the most consumers' eyes are, which is at the site level or at the provider directory level. Some of those other things, one is a pilot program that we've been working with a few employers on, and for outpatient cost estimates with the cost estimator tool. It's been in pilot for a couple years with just a couple employers and provides estimates of the entire day's worth of care of cost, not just the cost of a single isolated procedure, but what patients actually experience in the wild. We've also have familiar products to most of you, the quality counts outpatient, inpatient, and quality counts outpatient and inpatient reports, as well as the hospital safety scores, which in concert provide us with cost estimates and quality estimates in the case of the inpatient and hospital safety scores. Then we've got a whole additional warehouse full of knowledge within our customer relationship management system and CRM about which employers are signed up with what we like to call those what the employers' names are and whether or not they're part of Quality Path, things like that. So those are all pieces that we have an opportunity to take and build into a new site with something that as flexible as Doctor.com has been for us. So what we wanted was to take the best of all of those things and integrate it into one site at the place that we know the consumer's eyes are, which is on the provider directory. First and foremost, we want to maintain at least the same level of provider directory functionality, but in a modern interface, and I think you'll see that when Reed demos that. Then we want the consumers to be able to select their employer rather than some nebulous employer network. We want it to be more relevant to them, and by doing that, they can. We have the opportunity to target messages and sculpt the site specific, potentially to the employer level, to do things like messaging for Quality Path and other things that are potentially different based on different employers. Then, as we're returning results for the provider directory, we have opportunities to integrate information about hospital safety scores for those hospitals, and the area in our inpatient quality counts report where the consumers are engaged with the most, which is the birthing care. That's where they're typically most interested. We'll also build, we've built a flexible architecture so that we can extend this to more areas when we're ready. And this is not all, this is one of three, so I'm going to start going faster through here since I don't have too much time. This is the most interesting piece for my area, which is a data area, is providing cost estimation, integrating the best of our quality counts outpatient report with our current cost estimation tool, which has been in pilot for some time, and do a whole bunch of new things with that. Make the procedures something that consumers are aware of, so you're not searching for CPT code 72148 or a cholecystectomy, you're searching for a back MRI or a gallbladder surgery. You know, you can search either one of those and they'll both get you to the same result, but making it more intuitive for consumers. And allow them to search not just for a couple or even a couple dozen procedures, but lots and lots of procedures. We're close to more than 100 procedures that have an opportunity to have cost information produced on them. Then we want to display, in some cases, we want to return the physicians that are performing that service where it makes sense. Things like ACL surgeries and gallbladder surgeries, you're probably interested in the guy that's the physician, male or female, that's doing the service. Whereas if it's an MRI, you probably aren't very interested in who the lab tech is that's reading the MRI. So on a procedure by procedure basis, we made decisions about what should be returned. In some cases it makes sense to return one, in some cases the other. Then show the cost. It's a cost estimation tool, and not just the cost of a single isolated procedure separate from everything else, but you know, what was the cost of the radiology, the pathology, if there was any anesthesia, if there was any ancillary services, facility fees, professional services, and attributed them to the appropriate entity. So attributed them to specific locations, find the doctors that work at those locations that have the relevant specialties, that have performed in the past. There's a lot of things that go into this from a data perspective. And of course, we want to make sure we publish the data when it's responsible to publish it. So that is, we want to provide directional information to consumers, but also we don't want to give you a cost estimate if the sample size is 1. That threshold is fairly low for where we're at today in terms of a sample size, but we feel that we need at least a large N, in order to produce the cost estimation. Then we want our sort to make sense. We want to be able to promote the providers that are high value to our consumers and allow the consumers to sort by different mechanisms just as they can today, by distance or by, you know, if you want your 10,000-page alphabetized notebook, we got that too. Last thing, Still, for the cost estimate outpatient procedures, it's a complex area, and a lot of work has gone into it. We need to make the data feel more current. A lot of those statewide data sets that have huge volume size, also with that data, you're dealing with data that's often 2 to 3 years old. And within the markets that we can see, things can change during that time. So we wanted it to be more flexible, and we really want our consumers to be engaged on this. And so we've tried to find the balance that, throughout this process of making the information enough to be directional for consumers and providing some level of cost estimates versus those things that are really steerage worthy. So there will be material that we're producing for specific employers to help identify the subsets of those procedures that we're producing cost estimates on where we feel strongly about steerage. But a lot of that information is on the site today. And last and most importantly, we wanted the site to be flexible. We've talked about version 1.0 for a long time. One of the reasons we got into the relationship with Doctor.com is because we knew that they would be responsive to our needs and that there wouldn't be just a version 1.0 and it would sit out there for 4 years and become kind of old and stodgy. And there's going to be a version 1.0 and a couple months down the line, version 1.1 and 1.2 and 1.3, as they're just as excited about innovating in this space as we are. So with that, we've formed our relationship with Doctor.com, and we're excited to show you all a sample of our site today with the Find a Doctor site. Thank you.
I get the special honor of actually getting a chance to show everyone the tool itself, so I have less slides and more action. Before that, though, I want to talk a little bit about sort of how we got here and how this relationship got formed. So, as we have been building out the network and engaging consumers in a commercial space, it's always been sort of near and dear to our hearts to try to find an opportunity to be part of the sort of the movement forward, the ability to bring healthcare transparency to consumers. Because as they have opportunities in plan design to affect the system, you have opportunities in dealing with provider contracting to affect the system, you also have an opportunity with consumers themselves. Because at the end of the day, they're the ones who decide where they're going to go, and they're the ones who are going to decide what they're going to have done. And so we created a short list of organizations that we saw as being kind of progressive enough to take a chance on a consumer internet company and give us an opportunity to really bring something like this to market. And as we engaged with the Alliance, we really saw that this is the kind of organization that can do this. Like Kevin said, for 10 years, been publishing healthcare transparency information. That is the kind of organization we wanted to work with, and so we're really proud to be here with them today. So the first thing I wanted to talk about and start with is the homepage, because it's the homepage. This is your first opportunity to make an impression on a consumer that's coming through here. And as we thought about it, there are really kind of 2 experiences that can be had. One experience is where it's sort of a chore, it's an errand. You're making your yearly appointment for this or that, or for one of your family members. The other opportunity is even scarier. Maybe you're having a medical condition, maybe you're afraid. And we wanted to try to put together a visual design experience that was just simple and clean. Let me scroll down a little bit here so you can see we have a beautiful picture behind it as well. And so, with a visual design that was really open, we wanted to make sure that it was easy for everyone to use. So, as Andre mentioned, it has the geolocation, so you don't have to tell it where you are. And then, as Ryan was pointing out, we wanted to bring the employer into the discussion. In the previous tool that was being used, you just sort of picked one of these nebulous networks. But we wanted to start to give the employees the experience that it's being tailored for them and their needs, and at the same time develop analytics around which organizations are really taking advantage of the tool, so we can start to help yourselves interact with your employees and members. And here's one of the places where I actually got a chance to really innovate. So with these hybrid drop-downs, you can type ahead or you can select with your mouse, and there's sort of more than meets the eye here. So let's say you have an employee who knows that they work in the Pepsi bottling plant or the Pepsi distribution center. Even though Pepsi isn't in the name of the employer, we're able to list a set of alternative terms for that employer to try to help people find the right organization and start that search. And every single one of the fields on the site is like this. It gives us that ability to be anticipatory around what we might expect someone to think in addition to what they might actually know. Then the next thing we got to decide is what activity we wanted to encourage. So the activity we want to encourage is giving people the opportunity to see the best data possible. And the best data possible is always at the procedure level. You can't just show costs for a specialist. You have to show costs for a specialist doing a thing at a place. So we list procedure as the first form field that the person is likely to fill out. And here, let's get into it a little bit here. So I'm gonna log in so you can get a chance to see what some of this cost information looks like. By the way, as a disclaimer, the cost information is dummy information. So in here we have, sorry, it's hard to talk and type, it turns out. I do not want to remember that password. So with these member authenticated logins, we have this opportunity to start building what in the future can be more of a patient portal. We can start collecting information about who they've gone to see and when they've gone to see them. We can start thinking about reminders and compliance. Some of these sort of future thinking elements I'll touch on later, but I want to point that out as I log in. So let's tell a little story and do kind of a live search here. So I tore my ACL and my meniscus playing basketball in college. I grew up in New York, but if I had grown up out here and my parents worked for WEA Trust and maybe I was going to the UW-Madison Badgers, if that had happened to me, this would be the tool that I would use. So let's see what that experience would have been like. So I come in and I know that my knee is injured, so I type knee. So now I start to see a variety of procedures that are related to knee. I know that it's arthroscopic because I knew it was my ACL at that point, so we're going to select that one, and we're going to search. And so as Andre points out here, this is his favorite screen because this is where we really, the rubber hits the road on people getting a chance to see some of the information that's available and really start to make some active decisions. So using that Google 80% rule, let's take a look and see who's right at the top. Dr. Jeffrey Baer, who does arthroscopic knee surgery in multiple facilities, one of which is twice as expensive as the other, both of which are well known. This is a specialist who I figure is highly qualified. Additionally, one of the things that I can see is he's not just an orthopedic surgeon, he's also a sports medicine specialist. So this is the kind of doctor that I'm interested in seeing. And so as I look at the costs here, I see that this number is likely one that I'm going to save because I only want to spend $474,000 on my knee surgery. But again, dummy data, just a joke. So this is a number that I'm going to want to save. That's not all, though. You know, we have this experience which was sort of modeled after an Expedia or a TripAdvisor, where you have a chance to sort the cost up and down, distance and name, and you can start to expand the range that you want to look at altogether. So this is only a 15-mile radius. Maybe if I travel a little farther, there's a chance for me to save some money or see someone at a different facility. So let's expand it out a little bit. Okay, he's still the best in 25 miles. When I get to 50 miles, there's Dr. James Self. So he is now my lowest cost provider. He has the best cost tier opportunity right here. And so this is my second call. So this is how I would have used this tool to try to come up with the two opinions that I would need to have this service done. So now I'm a little older. And now let's think about a different search. So I'm going to go in and take a look at where we have some of the best quality information in birthing care. So I'm going to do this birthing care search. So right now, you see it's only able to find these two facilities. They both look pretty good. They're B's and C's, but with 5 stars for C-sections. This is a search that maybe I would think that I might want to look a little further. I know convenience is a factor, especially with birthing care, but I could drive a little further. So let's see what happens. If I expand it out to 20, well, still. If I go to 25, though, now all of a sudden there's a facility that is in the best cost tier, has 3 stars instead of 1 for the obstetrical trauma, and is actually a grade A. You know, this is a really simple set of search vectors to play with to give someone an opportunity to find care that might be the best facility for them to be at. And some of the things to tease again for the future here is, you know, with these variety of filters and sorts, this is where quality path comes in. There's a checkbox that's defaulted. It says show only quality path providers. These kinds of opportunities are there. And this is the way that we can start to use real consumer internet behavior to start to guide the way people use this tool and really get a chance to affect the way they select their healthcare. So I'm gonna go back to the slides here because I've been talking about the future and I want to keep talking about the future. Because this, as Ryan said, really is just V1. It's really just phase 1. So the next things that are coming down the pike are things about rich content and rich data that we have from around the network. You know, as we have these thousands of providers coming in, giving us images and video, writing their biographies, as we kind of crosswalk these data sets together, we're going to get an opportunity to bring in these images, show education and training. And with that, we can start to develop a single sign-in for the providers themselves, actually make this a tool for them too, where they can start to control the way they're sort of viewed in the network and control their image with consumers. Also, as a nice bonus, save the alliance time and energy with a paperwork burden. The other things, and this has become incredibly powerful all across our network and all across the web, is the ability to make appointments online. You know, people have these busy schedules, these busy work days. They want to make appointment requests after hours. If we can, you know, and we do this around the rest of our network, if you give patients the ability to do this, they will do this. And especially with some of these preventative sort of situations where you're going to see your primary care physician, if it feels like a chore and you have to take time out of your day to go search and do the thing, sometimes it's a little hard. If you can give someone 24-hour access to this, you can increase that kind of activity. And then the next thing has been the most powerful in our network to date, and that's peer and consumer feedback. So with ratings and reviews, you get a chance to hear what other people's experience is like when they went to see some of these providers. And this is sort of a digitalization of something which has been an essential part of choosing healthcare forever, which is like, hey, you know, who's your primary care provider? Do you like them? You know, we have this opportunity to bring that at scale. And that's going to be one of the pieces that we're talking about bringing into later versions of the Find a Doctor tool. So that's a sort of a brief display of some of the functionality of the site and a little teaser on what can come next. Again, we're really proud to be here today, and thank you so much for your time. And now we're going to open the floor for questions for any of the three of us.